How is everybody doing today? I want to talk to you about something that I am seeing a lot here lately, and it's something that I think is very, very important because it's something that a lot of people don't look at. What I want to talk about today is different markers in your blood that can be indicative of things that are bigger problems, right? And when you go and get your traditional blood work done. You get your or comprehensive metabolic panel. You get your complete blood count. You get just general things like that, and it all has great information in it. It's things that I often take myself because it's good information to have. But without more perspective, sometimes it doesn't give you the full information on things, right? It could tell you that you've got metabolic issues. It could tell you that you've got problems in the liver or the kidney or whatever else, but it doesn't tell you where that problem really lies. And that's where the value of some advanced panels really are. And some of these panels aren't really even that advanced. They're just things that aren't run very frequently. And I'm going to give you a few examples. So I am seeing a lot of people who have their blood sugar, like if we look at the comprehensive metabolic panel, their blood sugar is within the line of where it should be. But when we look a step deeper and we look at the insulin levels, instead of having their insulin levels where they're supposed to be and their blood sugar where it's supposed to be, their insulin levels have gone up significantly to keep those blood sugars where they're supposed to be. So they already have insulin resistance. They're already in a state where they are pre-diabetic. They don't have any clue that they are, and if we just did that comprehensive metabolic panel, we wouldn't know that they were. But when we actually do that insulin test, it shows us that they're insulin resistant. It shows us that they're heading toward a diabetes diagnosis in the near future. So taking just things a step further can make a massive difference, but that's not the only one. Another panel that we often run is the omega-3 to omega-6 ratio. And the omega-6 to omega-3 ratio is important because not only does it tell you what your inflammatory state is, but it gives you a decent idea of how the cell membrane is going to work too. The cell membrane should be made up of omega fatty acids. It needs to be made with the proper ratios though, because if we don't have the proper ratios, it throws off the ability to get things into the cell. And that's an important part of this, right? If we can't get the hormones or the nutrients or the things that we need into the cell, it's a problem. If we can't get the waste products out of the cell, that's a problem. So, looking at the omega-3 to omega-6 ratio, or omega-6 to omega-3 ratio is a more technical term for that. That's just the way it goes. We list the 6s first and then the 3s. Most people are going to be higher in 6s than they are in 3s. And if we have too high of an omega-6 to omega-3 ratio, it's a very, very inflammatory state. What does that mean? If you have a high omega-6 to omega-3 ratio, you have an increased risk of things like diabetes, you have an increased risk for cancer, you have an increased risk for autoimmunity, heart disease. There's a lot of things that really go with this. It's just a very, very inflammatory state. Now, what would be examples of omega-6s? A lot of the seed oils and things like that we're using, especially if they turn rancid, you get a lot more of those omega-6s. So our diet is filled with more omega-6 than it is with like the omega-3s, the flaxseed, fish oil. There's a lot of examples of omega-3s as well. There's not as many, and especially coming from the middle part of the U.S., we don't have a ton of this stuff, right? We don't have access to the ocean close by. So stereotypically, people here don't eat as much of the seafood. That's why a Mediterranean diet is good, though, right? It's something that offers you that seafood that's going to be there that is actually going to help to build those omega-3 levels up and decrease the inflammatory state. One other panel that I want to dive into. I recently did a panel on a friend who is struggling with some autoimmunity, and it's easy to assume that living in an agricultural area is going to increase your exposure to things like glyphosate, right? A lot of people, I think, and this is just total speculation, but I think a lot of people make the speculation that if they live outside of an agricultural area, whether they're in an urbanized area or they're not in a big agricultural area, that they don't have as much exposure to glyphosate. Now this person lives in a bigger city, And with that, it's easy to make that leap that there would be lower exposure to glyphosate, right? Glyphosate was 26 times higher than what it should have been. Think about that. In the middle of an urbanized area, glyphosate is 26 times what it was supposed to be. Now, glyphosate it's been associated with a lot of different things. Again, you have that high inflammatory state. You have the extra junk that your body is dealing with. So it's been associated with things like cancer. It's been associated with autoimmunity. There's a lot of different things that can go with this. So having those advanced panels and actually knowing, if we wouldn't have run those advanced panels, like I said, it's easy to assume that those things aren't there. It's easy to extrapolate that those things aren't there. Blood sugar was normal on the one person, but insulin was way up here. We would extrapolate that blood sugar was normal because the insulin was normal, right? But that's not always the case. And when we take things one step further, it just gives us a lot better information that we can use to actually better treat you. Design something that is customized to your specific case. And that's the important part of this, right? Because it doesn't matter what somebody else is having. It doesn't matter what works for somebody else. We have to customize this to you. Your experiences are unique. Your genetic profile is unique. Your epigenetic expression of that is unique. With that, we have to customize your care specifically for what you need. What works for somebody else, like diet-wise, may not work for you. What works for somebody else sleep-wise or habit-wise or routine-wise isn't going to work for you. We've got to customize all of that. These are some of those things that allow us to get that customization and take your care to the next level. So if you do have any questions, obviously I am happy to help however I can on that. But these advanced panels are something that, like I said, it's not something you find in many places. And it's important information, especially if you are starting to see that expression of the disease process. You are starting to move toward that unhealthier expression. You're starting to have symptoms in any way, whether that be something as simple as a pain syndrome or a little bit of insomnia, or it's persistent insomnia, it's autoimmunity, it's cancer, whatever. Getting these advanced panels can give you some better cues as to what you're actually dealing with, so we can get to the root cause of that. So I hope that you find this helpful. I love and appreciate all of you, the time that you spend with me. I mean, that's your greatest asset, right? So I really, really appreciate you doing that. And I can't wait to see you on the next video.